Okay, let's talk about junior doctors in England now, because they've launched fresh strikes as the dispute with the government over paying conditions continues to spiral. This also comes after the UK's National Health Service records, their highest waiting list now. Right, okay, let's break this down. So junior doctors, they are striking and it's scheduled until Tuesday. They also make up about half of doctors in the UK. Now, junior doctors, they are demanding a pay hike of about 35%. The government has offered to increase salaries by a mere 6%. The UK government claims backdating their pay to reflect inflation since 2008 would be just too costly, as the country is battling high inflation. Now, the UK's Health Secretary said that the pay rise of 6% with an additional lump sum of $1,590 announced by the government is final. He also urged the British Medical Association to end its strikes immediately. Well, the recent walkouts by nurses, doctors and medical staff has affected the services of an already fractured NHS. Huge backlogs here in the UK. Well, the hospital waiting list is now topping over 7.57 million in England for the first time. Nearly 1 in 7 of the population is on an NHS waiting list for routine treatment. Now, this includes patients with hip and knee operations. The UK government and the NHS England had set a target of eliminating all waits of more than 18 months by April this year, but the recent data release shows a staggering rise in patients on hospital waiting lists. Now, more than 383,000 have been waiting longer than a year, while the NHS is struggling to cope with rising cancer patients, while only 59% started their treatment within 62 days following an urgent GP referral during June. Alex Isaac is joining us live from London now to talk again about another strike here in England. Junior doctors once again demanding that 35% pay rise.
Absolutely, and it's not going to stop here. It's junior doctors on their 4-day strike, and then followed by senior consultants when they're going to be walking out for 48 hours in a couple of weeks as well. So it does feel that the doctors are still willing to get on that picket line to try and get that monetary bonus. Of course, the government has said that they can't afford to give more than 6% that they've given out to other public sectors. But the doctors and the BMA, the union, have been saying that this isn't just about that money. It's not about the fact that they haven't been paid towards inflation for the last 10 years. It's about retaining and keeping staff. And that backlog that you mentioned, nearly 7.6 million people, that has also been blamed on COVID, the fact that a lot of the hospitals had to go to minimal hours. But the BMA has said it's not just about COVID, it's definitely about the staffing issues that haven't been looked into. There's not enough money that's been put into the NHS over the past decade and beyond. And that's the problem. Why they not just the people are striking, but actually why the NHS is crumbling completely. The BMA has said that it's up to the government to be reinvesting money and not necessarily just talking about they're putting in the virtual wards, but about how to get staff and keep staff as well. We do hear often about those that were working in the NHS going abroad for a better pay and a better lifestyle, and the government doesn't seem to be moving much on that. Rishi Sunak, one of his promises was to get extra staffing into the hospitals, but there hasn't been too much of a push. It isn't the best of pay if you're a nurse or a hospital worker. Obviously, becoming a doctor takes years of hard work as well, and when you start out, it's not as well paid as towards the end. So there's all of this issues within the country that is stopping the NHS from working to its highest standards, the best it can be. But a lot of people in the UK are really still behind those that are striking within the NHS. They do feel that the NHS is really important. It's one of the legacies of the UK. It's talked about around the world, but something really does need to be done. At the moment, it does feel like the government is taking a step back rather than trying to reinvest and trying to push this forward.
Alex Isaac, thank you so very much indeed. I know you're watching this story throughout the day. Junior doctors in England launching their 5th round of industrial action. Thank you so much.